One of the most important parts of our chiropractic spinal balancing work, according to myself and other applied kinesiologists who've studied the kinesiology to a high level, is something we call balancing of the skull or the cranium. Some of you may have heard of the term craniosacral therapy or craniosacral balancing. This goes with the concept that as we breathe and move, not only does our diaphragm go up and down, letting air come in and out of our lungs, but our entire body breathes and moves in what I'm going to call a synchronous harmonious motion. As we breathe, our tailbone goes in and out and wags back and forth a little bit, almost like a dog's tail wagging in reference to our breathing pattern. At the same time, the joints of the skull actually go through microscopic motion or movement. As you breathe, the skull breathes and moves and shifts very gently, very lightly with every breath. As the skull bones move in synchronous harmony and the tailbone moves in synchronous harmony with our breathing, this helps pump cerebral spinal fluid up and down the entire spinal cord and help keep us balanced. Any patient who has a proper balance of the cranial respiratory motion and motion of the skull plates and skull bones as they breathe, and the sacral respiratory motion of the tailbone, the hips and pelvis as they move and they breathe, need to see chiropractors less often. When the body is properly balanced in the craniosacral system, the rest of the spinal areas want to stay lined up and want to stay adjusted properly. So I'm convinced the most powerful treatment any chiropractor can ever do is a proper cranial adjustment. Those of our patients who've had head impact injuries, auto accidents, work injuries, sports injuries, concussions, closed head injuries of this nature almost always have cranial distortion problems. One of the other categories I find is that even when the dentist does a meticulous job of restoring our teeth and doing proper dental work and giving us a good bite and a good look, he sometimes inadvertently causes torque of the jaw, the neck, the skull while doing these major dental procedures. Any procedure that's more than a cleaning or a simple filling may cause an inadvertent cranial torque. A number of our patients will not schedule a dental visit for a major procedure unless they schedule a visit with us afterwards, because we often have to help put them back to balance just because of the tremendous amount of pressure and time is involved of torquing the jaw, torquing the skull inadvertently from these procedures. When we're examining the patient for craniosacral balance, we want to make sure that not only are the skull plates lined up and moving properly as the patient moves and breathes, we want to make sure the pelvic joints are lined up and moving properly as the patient moves and breathes. We often will test the patient in different twisted positions. Bring your knees up and bend your knees left. And we're going to try strength here and hold. As she bends her knees left, the pelvis moves nicely, everything is strong. Bend the knees right and hold. As she bends her knees right, the pelvis is balanced and everything is strong. Turn your head all the way left and hold. As we have head rotation in, we remain strong. Turn the head right and let's go with knees to the left. And again, hold. And as we add head rotation, she's strong. So we look at the balance of the top and bottom system, what I think of as the twin sister locations between the top and the bottom. Everything moves well, everything stays relatively strong. So now, we want to look right up into the skull itself, the so-called cranial area. I'm going to ask you to take a deep breath in, and hold, and blow it all out, and hold. Now, I always tell patients breathing should make us stronger, not weaker. If we get a weakening response on deep breathing in, deep breathing out, these skull plates are not moving and breathing as she moves and breathes. We may need to do a major cranial adjustment to untorque the skull and get all the membranes inside the skull balancing with the harmonious motion of the skull, the spine, and the pelvis. Now, you can get a close-up of this in a moment if you like. Now, at this point, we have a patient with a cranial imbalance problem, and we're going to show a little bit of what it's like to do a major cranial adjustment. I'll be applying some pressure on the back of her head gently with my fingers, and I'll also be taking a finger and pushing up inside the mouth. We have locations inside the mouth that allow us to access most of the skull bones and skull plates and get them back to motion again. Open up for me, please. I want you to take a deep breath in. And out, and in, and out, and in, and out, and in, and out. Now if we properly brought all the skull plates and bones into balance that breathe and move as she breathes, we should have strength upon farther testing. Take that deep breath in and hold, blow it all out, and hold. So there's two rules in craniosacral balancing. We should all be able to twist both left and right without growing weak. We should all be able to breathe in and out without going weak. I'm convinced it's not too much to ask for. If we can twist and move and breathe and stay strong, we are much better balanced.